Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain Free with Dr. Marc Darrow. We're taking your calls here in the studio at 866-870-5752. That's 866-870-5752. I have lines open for you right now. And check out the website at www.lastemcells.com. And right now we are talking with Julie. Did you want to finish up with Julie?
Julie, I don't know if you're... Yeah, Julie, are you still here with us? Dr. Marc Darrow here. I'm going to finish. I hope you're listening still on the radio, Julie.
There she is. I found her. Hi, Julie. Hi, Julie.
You found her. Okay.
I'm here.
Okay. Yeah.
Julie, you with us?
Yes.
Yes.
She's there?
With you.
Okay. Okay, good. I had a lot more information for you. I'm sorry. So, I actually had a shoulder surgery in 1994 during my last year in medical school, and it was from tennis. I was playing a lot of tennis, and my shoulder hurt exactly like yours did. And,
I remember the story, yes.
I'm going to say it like that.
With therapy, and you were a new man.
Yeah. So, my shoulder hurt real bad. I mean, it was terrible. I couldn't play tennis. I couldn't do anything. So I was doing orthopedic surgery with my professor every day. And I thought, you know what? I like this guy a lot. He's getting great results. I'm going to have him do my shoulder. So he did surgery on my shoulder. He did a acromioplasty, which is opening up the shoulder and cutting off part of the acromion, which is the top bone in the shoulder, smoothing it out, getting rid of a little bit of a osteophyte, which happened from a very heavy serve that I had. I used to win tennis when I did win just from the serve. I wasn't that good with the rest of the game. So what happened was I woke up from the surgery and I had a high fever and my arm looked like a balloon, right? And I was really freaked out. I thought I was infected. I wasn't. And it took about 2 years for that arm to settle down after the surgery. So I did inject it, as everybody who listens to me on the show knows. I repeat this story every time. And the very next morning, I woke up completely healed. It was shocking to me. So, shocking in a good way. And that shoulder was without any pain for 12 years until I re-injured it. Doing what? Tennis. And the next time I had to do it twice. I did it once, it didn't heal up right away, and I did it the next week or so.
And how long did you wait in
between? And it healed up again. I generally inject myself. I mean, this is going to sound crazy. I generally inject myself very quickly. I don't do it with patients unless they're elite athletes, who want to heal up really, really quickly. There's a story I've told. I hurt my knee running a lot and golf a lot. And it was back in the COVID time when we had to push a golf cart, and I play golf at Mountain Gate, which gives you the hint that it's up and down the mountains. And I was pushing my cart through, fairly deep grass at some points. And finally, by the end of the game, I couldn't walk. My knee was so bad. I drove over to the office, which is not far from the golf course. My office is in West LA, across the freeway from UCLA. And I got out my ultrasound, and I was again in shock because my knee was full of fluid. And I was like, I can't believe I did this to myself. So I aspirated my knee.
Yeah.
That means I took the fluid out. I had 35 cc's, which is a good amount. Taken a lot more out of some people. I had one guy took out 300 cc's of blood when he ripped his ACL. 35 is a good amount, 35 cc's. And then I injected myself and did it 4 times during that week. And by the next weekend, my knee was pain-free. So when you ask how often I do it, generally with patients, I ask them to come in every couple of weeks, but they cheat on me and they don't show up all the time.
Okay, so my question is, how long after you inject yourself, then were you able to go back and play?
I did go back and play.
How long after your injection? I went back to
running. And no, I don't remember. It was a few months ago.
I mean,
it depends on me versus you. If it's you, I'm going to not let you do it until it's really, really healed. On me, I'm going to jump the gun because I can just go into my office the next morning and do another procedure. I have that ability to do that. You don't. So if I get a high-level athlete, they will typically come in about once a week, sometimes more frequently. I had a gentleman from Georgia fly up, and he had very advanced arthritis in his knees, and he had me do stem cells 3 times in 1 week. It was on a Monday, a Wednesday, and a Friday. And then he flew back home to Georgia, and he gets a hold of me once in a while, letting me know that his knees are perfect. So it's different for different people. When people fly in from other countries, we're obviously going to do a bunch of treatments all together. Sometimes we have people flying from other countries that stay here for a couple months to be treated. So it all depends. There's no Bible of how this works.
Okay.
It's something that we try to figure out depending on what the person needs.
157 as far as an injection into that.
No, I would try it. Definitely try it if you think it's safe, if your doctor thinks it's safe. It's a series of injections that you give yourself, so you have to be able to do that. But I'm open to experimentation. I've been on the forefront of regenerative medicine for the last 20 plus years, and that was a big experiment for me. It's not an experiment anymore because I've done so much of it.
Right.
I'm not sure, but when I go to national meetings, people come up to me. They tell me I do the most of anyone on the. So I'm doing a couple hundred procedures a month. And I don't know if any of you other doctors out there do that much. Most docs come up to me at the meetings and they say, you do more in one day than I do in a month. So be careful who you go to. You want to go to someone who does a lot of this. When you had your PRP, how many pokes in the shoulder did you get at one time?
Well, he kind of fanned it around a little bit in some places. You know, it would encompass the insertion there of the bicep deltoid, and then, up into the deltoid, because we had quite a few syringes, because I drank a lot of water and hydrated and got a lot of plasma. We also did, the supraspinatus. Okay. And in the back. So I think he's very experienced.
Good.
Wondering, is it possible that this isn't going to work for me because I'm so frustrated. You know, I've completely lost my tennis game on 2 hands now, and that's frustrating. And then you have pain, and you've lost your strength, I used to be able to lift a 20-pound weight.
Well, I'm not going to promise you anything. Yeah, I'm sorry all this is happening to you, but I've been through it too. I have a supraspinatus tear. You can see it on ultrasound. I have a subscapularis tear. You can see it on ultrasound. And I have a labral tear. You can see it on ultrasound in my right shoulder. I have 0 pain.
Well, that's great.
So it's not those tears that necessarily cause the pain. So when I inject a shoulder, I'm probably going to inject it 30 or 40 times to make sure I'm covering all the possibilities, because we don't do it just based on putting the cells into the tears. missing the
So
boat
you're
if you
go
do
in
that,
and out of
because the
in
tears
and
don't
out of the
necessarily
shoulder
cause
area,
any
or the
pain.
skin, I should say. So the needle actually comes out, or do you fan it around when you're in there?
Both. I do both.
Okay. All right. All right. Well, I may come to you for a consult, and we'll.
And I use an ultrasound to make sure I get to the right spots. A lot of doctors don't. If they're not using an ultrasound, they're going to be missing the most important areas to get into.
Yeah, because that really pinpoints it, doesn't it?
Well, you can see, a teeny 1/8 of a millimeter. The ultrasound expands the picture. You're looking inside. Makes it look large, so you can see the teeniest little thing. Studies show if you don't use an ultrasound on shoulders and knees and hips, you're missing the joint quite a bit of the time. You're not even getting there. We were all trained back in the day without ultrasound, and we were all missing the joints. Years and years ago, at national meetings, we'd get together and say, why don't hips heal as fast as other areas of the body? Do you think it was?
Ultrasound.
That's right. We weren't getting into the joint. How do you heal it if you're not hitting it?
Exactly. It's like hitting a tennis ball, right?
We used landmarks on the body. Landmarks on the body don't work very well. You've got to see it.
So can you see?
Those joint areas are minuscule. They're teeny.
By 2 months, we're missing it. If you use the ultrasound, would you see the exact area that you would? Or would that ultrasound enlarge the area, and you'd be able to pinpoint it?
Hopefully, that's what it does. That's why you use an ultrasound for guidance. Some people use a live X-ray. I don't do that. I don't want to be around all the X-ray, and I don't want to subject my patients to it. And the ultrasound is so easy. We have one in each room, and we can just fire it up in 2 seconds and take a look.
Oh, okay. Well, that sounds good. So I may take a little drive up to Los Angeles. That is it.
Well, I think there's good hope for you healing. And again, I won't promise you anything. And people look at my consent. I'm a lawyer. I don't know if you...
I do.
And I have a very complete consent, which was really made because of patients complaining. So every time there's some kind of complaint, I'll give you a story. There was one girl whose low back I injected, and she got completely better. She called me up six months later, literally screaming at me, saying I promised her she would never have pain again. So I went to my consent form and I typed in no guarantees. Now, I never guaranteed anyone ever have pain again because the doctor can't guarantee
that, but
in her mind, she heard that.
She wanted to hear
So
it.
I have a very complete consent form. And yes, well, whatever. There's studies that show when you go into a doctor's office, you don't hear what the doctor says. And I can promise you, when I go to a doctor, I don't hear what he says because I'm so nervous. So I put it in writing, and very big font. And people often say, well, I don't want to sign that because it shows that terrible things can happen. I go, that's right. And if you don't want to sign it, I'm not going to treat you. And it's the same consent that you've signed with every other doctor. It's just their font was so small you didn't read it. Mine, I make people read. I want you to know things can happen.
Yeah.
Now, the lucky thing in my kind of work is it's very, very rare that anything negative happens. It's just an injection. Most people get a little bit stiff afterwards, and that's about it.
Yeah. Well, okay. Understood. I've had many shots. Still, struggling, but I guess maybe I don't give it enough time off. I'm like this.
Well, you may not give it enough time off, and it may be the very next treatment that heals you.
Maybe. That'd be a godsend, wouldn't it?
But if you're gonna get this done in your shoulder, if you're gonna get regenerative medicine, PRP, or stem cells in your shoulder, you need an ultrasound. There's no way you can do it without the ultrasound and hit all the spots. The other thing is you may need to add stem cells to this to get it healed.
I had those too.
P is great, but it doesn't fix everything.
You use the ultrasound.
The stem cells mixed with it is a much powerful combination.
You use the ultrasound for all 30.
No, you don't need it for every one of them. You don't need it for every one of them, but you need it for a few of them.
You need it for what?
You need it for a few spots, yeah.
And then pretty much, pinpoint it. So, okay.
It depends on the person. It depends where the pain is. I can't give you a one-size-fits-all. Everybody is different.
Good thing.
But if you're going to get a shoulder PRP treatment, you definitely need an ultrasound. Hip, you need it. Knees, you need it. You absolutely need it.
Okay. Well, that sounds great. Thank you so very much, and great show.
Thank you for your
call,
Julie.
Thank you, Julie. I appreciate all the time you've taken to help us talk about all these things so everyone else can hear about it, too.
866-870-5752, our number here in the studio. Give Dr. Darrow a call. Would you like to talk to Jeff in Redondo Beach?
Has Gary been waiting longer?
That is correct, but it's not coded correctly. But let's go to Gary in West Hills. Hold on, Jeff. We'll come to you next.
Gary, I understand. Jeff, you're right on next, so don't go away. Gary, you've got neck and pain. Which is worse?
The back pain is worse. It limits everything I do. I can't run. I can't lift. The neck pain may cause more pain, but it's controllable if I stretch my neck properly. So the back is more affecting me, the lower back.
Oh, that's good. Okay. So everything I would tell you about your low back applies to your neck. They're similar structures with the different vertebrae and the ligaments that connect to them. And do you have pain down your arms or legs, or just basically in the low back and in the neck?
In my buttock, and I seem to be getting some degeneration in nerve function. My left side calf muscle seems I have trouble activating it, and just standing on my toes on my left side. And when I try to lift my leg up to put my shoe on, I can't lift my left leg as far as I can my right leg. So I'm afraid that there may be some neurological impairment. And I get a lot of severe pain in my buttocks area.
Have you seen a neurosurgeon about it?
I just got a referral for a neurosurgeon, but I haven't gone to see them yet. And it's been a problem for years, and I just don't want to have surgery. So I've been trying to control it. I'm in good shape. I'm 66. I'm in good shape, good weight. Not as good a shape as I'd like to be because I don't work out nearly as much as I used to. But I can do 10. I can do 20 burpees. So just to give you an idea. Yeah.
Well, the fact that you can give 20 burpees means you're in pretty darn good shape. And the stuff you're having may or may not be involved.
What's that? I got back in the car because I wasn't.
Oh, I think we're losing you, Gary. Do you want to finish?
The car start up.
Yeah, we'll finish. We'll
just finish up
off the air with you, Gary. So keep listening. Go ahead, Dr. Darrow.
Yeah. So number one, I'm glad you're going to go see a neurosurgeon. If you do, make sure that he orders, or if you come to me, that I order an EMG and a nerve conduction study. Because a lot of things we think are neurological, and they are not. Back in the day when I started medicine a long time ago, we never had people do surgery without an EMG and a nerve conduction study. But now there are so many surgeons that they're competing for these surgeries, and they sort of rush into it, I'm sorry to say, and they don't get this exam done. That exam will help us figure out if it's a neurological issue or not. A lot of things look like neurological issues, but it may just be that you're having pain in your back and you can't fire off the muscles as well as you did before because it hurts and you're guarding it. So I don't have an answer for that. If you decide to come in, I'll look at it with you. The phone number to the office is 800-300-9300. I'll repeat it while you grab your pen. It's 800-300-9300. And we can look at that with you. The low back pain and the buttocks pain, we probably can help you get rid of using platelets or platelets and stem cells. And again, I would have to touch that area to see what's going on. But I do want you to get that neurological consult as soon as you can, because if it is a disc or the facet or arthropathy going on that's causing that nerve to be pinched, if you let it go too long, you cannot recover the nerve. So that's always a difficult situation to decide. All right? Gary, thank you so much for calling in. God bless you. And are we going to Jeff next?
Redondo.
Jeff, Dr. Marc Darrow, you have 2 torn rotator cuffs in your shoulder. Why? I have 2 of them also. But guess what? I don't have any pain. So what does that tell you?
Got your pain then too.
That's so thoughtful of you, Jeff. So thoughtful.
That could be.
No,
thank you. Thank you. God bless you again.
I've had it for about a little over a year and a half. My right is a complete tear, and the left is a partial tear. But I'm limited as to what I can do as far as with my arms. I have had 2 consults from different orthopedists. One is a traditional, more of a orthopedic surgeon. The other is a regenerative from a fairly prominent clinic, not necessarily in the stem cell area. And the long and the short of it is the orthopedic surgeon says the PRP may be of some use for the partial tear, but not on the full tear. And the orthopedic surgeon is about as reluctant as far as stem cell for the full tear. So that's really...
Okay, yeah. So let me ask you a question, Jeff.
Sure.
Let me ask you a question. First of all, I don't do surgery anymore, okay? I did a lot of it in my training, but I don't do it anymore, okay? Would you go to me to have a surgery?
I'm sorry, doctor?
Okay, I don't do surgery. Would you come to me to have me do a surgery? No. Okay, why are you going to an orthopedic surgeon to think about regenerative medicine? They don't believe in it. So if you get it done by an orthopedic surgeon, they'll probably do it one time, tell you it didn't work, and then usher you to the operating room. Now, that's not a negative statement about orthopedic surgeons. It's a different religion than mine. Do you understand what I'm saying? We're both raised differently. Don't go there
sorry, Jeff.
to get
We're
regenerative
totally out of
medicine.
time here on Living Pain Free with Dr. Marc Darrow. Thank you for your call. If you didn't get selected today, call next week or go to the website, and that's www.lastemcells.com. I'm your host, Nita Valens. Thanks for listening, and we'll see you next time.
You've been listening to Living Pain Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, to take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. and thanks for joining us today.